I'm Dr. Scott McFarland. We've all experienced it at some point in our lives. Pain in the lower back. The pain can be intense. It may last for days, but occasionally it can linger for weeks or even longer. Fortunately, most people eventually recover and can resume normal activities. But for some, the process of identifying the cause of the pain and the journey to find relief can be frustrating. 74-year-old Washington resident Bill Nance is a retired law enforcement officer who's been active his entire life. With all his activities as a college football player and 30 years on the police force, Bill has never had low back pain problems. His trouble started in 2007.
The family went to Hawaii for Thanksgiving, and we'd done a lot of things, climbed mountains and did a lot of hiking and things, and everything was fine. And then about the day before we were going to leave to come home, we were walking downtown someplace, and it was like I stepped off a curb wrong, and I had this real bad pain in my back. And so I never thought a whole lot about it, except I hadn't had that kind of pain before.
Bill took ibuprofen to help manage his pain. He was in such discomfort, though, that the thought of flying back home was intolerable.
That morning that we were going to get on the airplane to come home, Bill, I was having a big problem. I could hardly get to the airport and on the plane.
When Bill returned home, he continued to treat his low back pain with over-the-counter medication. He hoped it would get better on its own. But after several months, Bill decided to see Dr. Chow.
Hi, Mr. Nance.
Hey, good morning, doctor. How are you?
Good to see you. How are you doing?
After a thorough examination and history, Dr. Chow was able to identify where Bill's pain was coming from. In Bill's case, his low back pain was a direct result of aging. Dr. Chow ordered an MRI, confirming Bill's spinal stenosis. For most individuals, an MRI, X-ray, and CT scan are not needed to diagnose low back pain. If the healthcare professional takes a detailed evaluation and history, he or she should be able to rule out whether the pain is coming from something anatomically wrong or not.
I think it's important for patients to understand, why we're doing what we're doing, why we don't recommend imaging when we don't have a reason to do it. We also think it's important for patients to understand that there are choices and that the choice of which therapies to do doesn't need to be dictated by someone else.
27-year-old New Hampshire resident and mother of 3, Naomi Hastings, is no stranger to pain.
I was actually working at the time in a salon, and I was in heels, which always helps. And I was walking around, I think it was about 5 hours into the day, and it just started getting worse and worse over the course of an hour, to the point where I was in the back bawling in the back room because I thought it was a kidney stone because my back hurt so bad that I couldn't sit still, and I was just bawling.
It turned out that the pain Naomi was experiencing was coming from her low back. Doctors placed her on a physical therapy regimen with medication, and that seemed to ease the pain for a while.
So it started getting worse instead of better when I was doing my normal, every day, every morning, normal warm-up. And then I started getting tinglies in the back of my leg. And then I was like, this is weird. All right, I'm just gonna go chill out. And then it wound up being a traveling, sharp, tingly sensation pain that instead of just being achy, dull pain that was in my low back, it traveled all the way down to my leg to the point where it not only did it hurt, but I couldn't feel it. I was just annoyed. I was irritated because I couldn't do anything.
Well, low back pain can have a tremendous effect on quality of life. It's the most common cause for disability in younger adults, so adults younger than 45 years. It can prevent people from engaging with their families and friends and participating in social functions, and it can prevent people from, leading an active, healthy lifestyles.
Often, people are not prepared for the severity and duration of the discomfort associated with low back pain. The recovery time may be longer than they want. This can be both frustrating and emotionally draining.
So when did all this back pain start?
Naomi Hastings, whose pain has been on and off for the last few years, decided to visit the Spine Center at Dartmouth-Hitchcock Medical Center.
They did the normal physical exam to see flexibility and strength. So I'm just going to go back to physical therapy and continue with more exercises and see if we can expand on that. And possibly, they said, some ultrasound might help to get in there and break up and loosen up probably a lot of sore muscles that are in there.
Naomi is in the beginning stage of her journey to recovery. Although optimistic, she's not getting her hopes up just yet.
I've developed quite a high pain tolerance and quite a high ability to just deal with it and figure out another way to do it so that doesn't hurt so much. But I still try to do everything that I would normally do. Just some days are worse than others.
74-year-old Washington resident Bill Nance, who was diagnosed with spinal stenosis, was given several options for this condition. One of them was surgery. The other was physical therapy in combination with medication. He decided against surgery and is managing well.
Basically, I was afraid to have surgery, and I wasn't about to go through that.
What really is needed is kind of a lifelong management strategy where patients learn how to moderate their activities, continue exercises in a way that keeps the joints flexible, keeps the muscles strong, keeps the nerves mobile, and allows them to function even if they have episodic pain.
Bill has gone through intensive physical rehabilitation and has maintained an exercise program for the last few years and manages any flare-up with medication.
I feel I'm in really good shape for 74 years old, and we continue to do things. I think as long as I stay active, is going to be fine.
It bears repeating. In most cases, low back pain will heal itself. The important thing to remember is to try to stay active. Keeping the bones, muscles, and nerves flexible can help speed up the healing process. But if the pain does not go away after several days and begins to interfere with your quality of life, it might be time to see a health professional. There are treatments that can help. To answer any specific questions you may have, be sure to contact your healthcare provider.